After dimpleplasty, how long will the indentation be visible when not smiling?
The desire to have dimples has been continuously growing in popularity in my practice for years. Regardless of ethnic background and cultural differences, there seems to be a universal appreciation of the attractiveness of cheek dimples. I'll discuss how I help a wide range of people who come from around the world to have a procedure called dimpleplasty and what that recovery process is like afterwards. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I became well known for dimpleplasty since relatively few cosmetic and plastic surgeons offer this procedure or perform it often enough to make it a routinely performed procedure in their practice. In fact, we've been featured in the media for this procedure, which to some degree is driven by the popular celebrities whose dimples inspire people to want the same. In addition, many of my patients relate stories about their families where certain family members had dimples and received praise for them in a way which made the patients focus on getting dimples for themselves. Natural dimples occur due to a defect in a muscle in the cheek called the buccinator muscle. When a person with this defect smiles, there's a dimple. Naturally, dimples can be shallow to deep as well as symmetric or asymmetric. In terms of the dimpleplasty procedure, I take measurements from the corner of the mouth to the cheek to determine what I call the sweet spot for a dimple placement. Anatomically, I try to create a dimple where one would have occurred naturally. In fact, there is actually a limited zone where a dimple can be most effectively placed. Even though I try to place the dimple as symmetrically as possible, I show my patients how the human face is naturally asymmetric. I usually have patients place something on the cheek to press inward to see where the dimples will be placed and how they will look when smiling. Once we've agreed on the planned placement, we go ahead and we do the procedure. The procedure is typically done from the inside of the cheek, although an outside approach may be necessary in some situations. I create a small opening inside the cheek and I connect the buccinator muscle to the cheek skin with a suture. This results in an indentation which confirms a successful connection having been made. In terms of the healing process afterwards, there are two important aspects of dimpleplasty healing. The first is that this procedure is done from the inside of the mouth, which naturally has a lot of bacteria. I discuss with the patient some precautions about food and some instructions about oral hygiene. The second aspect to be aware of is the presence of a visible dimple at rest. Patients who have this procedure understand that a temporary indentation in the skin will be visible even when not smiling throughout the healing process in the early phases. Interestingly, most patients don't have any issue with this. As healing progresses, the presence of the indentation diminishes so that the dimple appears more with smiling than at rest. Cheek indentations at rest can be present for several months after surgery. Variables which affect the depth and more obvious appearance include skin thickness, skin type, age, facial fat volume, and surrounding bone structure. Dimpleplasty is an outpatient procedure done with local anesthesia, so recovery is quick. Patients normally return to work in a few days after the procedure. The appearance of dimples becomes stable as the temporary indentations are no longer visible when the face is at rest. Having a strong connection between the skin and the muscle is key for long-lasting dimples. Maintaining long-lasting dimples has some relationship to weight gain, since an increase in fat volume in the cheeks can cause dimples to become less prominent and even no longer visible. Sometimes dimpleplasty needs to be revised if the depth of the dimple becomes too shallow to the point where the dimple doesn't appear with smiling. Dimpleplasty can dramatically accentuate your smile and enhance your facial features without otherwise altering your facial character. I can say that many dimple patients are highly motivated and are extremely happy with their results. I hope you found this information helpful. Thank you for your question.